but there's no good road, no transport, so it's an issue of infrastructure as well. So again, just briefly, we may say that these are sort of the immediate cause of his death, the baby's death, just not getting vaccination, not having being able to take the baby on time to the hospital, not having the money and things like that. But of course, in the macro level, these are the issues around the date. So it's an issue of health service, issue of power relation, issue of poverty, infrastructure, and things like that. And you all can very clearly observe that there's an issue of inequality in all these aspects, inequality in the access of health service, in terms of power relation, in terms of allocation of resources, in terms of health-seeking behavior, and things like that. So in other words, I might say that it was inequality that killed Babu. And these inequalities are very social and cultural. This is a story from, of course, a very one of the poorest country in the world. What about if I look one of the developed country, UK, where currently I'm working, I'm living in UK at this point. But interesting to see that, I mean, this is what a newspaper at UK says, that you'll be lucky to live for 60 here, but it's not a third world, it's a Glasgow East End. So after, they have this very comprehensive national health services that has been introduced 60 years back. And after 60 years of services, there's still, in Glasgow, the average male life expectancy is 54, while in Chelsea and Kensington it's 81 years. In UK, they divide the society into different occupational classes. So they have very distinctive 5 occupational classes, starting with professional, managerial, non-manual, skilled manual, semi-skilled manual, and unskilled. So in every aspect of their discussion, this social classes is quite important in part of the discussion. And it was found that there's a lot of disparity in terms of health indicators in these all different classes. The Black Report that was published in the 80s has revealed these extreme inequalities in different classes. So it was found that the mortality rate is highest in the 5th grade, which is the manual unskilled labors, but is lowest in the professional group. And of course, in life expectancy, although it has improved over time, but there's again a big gap between the different classes, and it's of course lowest in the working class, where it's highest in the professional class. So if I sort of look beyond Bangladesh and UK and try to see some examples globally, and I'd like to take the case of re-emerging infectious disease. We know that there are a lot of infectious disease that is re-emerging. But what it means by re-emerging disease, and as you all know, that it means newly appearing infectious disease, disease that are spreading to new geographical areas, disease caused by pathogens with new pathogenicity, and diseases that are formerly controlled by antibiotics but have developed antimicrobial resistance. So these are emerging. But the point is, it is not emerging randomly. These re-emerging diseases are not random. It has a clear pattern. If we ask how it is emerging, and if we take the case of Ebola, say in 70s Ebola epidemic, we see that there's a clear indication of the Ebola epidemic and use of unsterile syringes. And use of unsterile syringes were inversely proportional to one's social status. And it also reflects how the disease is portrayed in the medias and being made visible. And Ebola was highly visible at that time through media, and even there was a film made on Ebola epidemic, although it is a minor player statistically in terms of mortality. If we ask where it is emerging from, and if we take the case of tuberculosis, it's very clear that it is definitely emerging from the most poor and the minority. And the drug resistance has direct relation to poverty. And after emerging, where is it going? And if we take the case of AIDS, it's very clear that there are a lot of controversies from where did AIDS emerge, but it's very clear that it's going to the poor, to the malnourished, and to the women. So we can very clearly see that there's a very obvious relation of inequalities in terms of distribution and outcome of these infections. Many years back, I mean even more than centuries back, as virtual as probably many of you know this quotation, but I just would like to repeat it again. As he said more than a century back, that medical statistics will be our standard of measurement. We will weigh life for life and see what the dead lie thicker among the workers or among the privileged. I'll just highlight some of the issues around relationship between social inequalities and health. So it definitely has a relation with it has a material relations where individual income determines the diet, housing quality, polluted environment, and dangerous work. There's a cultural and behavioral relation, of course, and there's a difference in beliefs, norms, values, mean that individual members of less advantaged social groups are less likely to adopt healthy lifestyles. There's of course psychological relations and the status, control, social support at work or at home influence health through their impact on the body functions. A lot of study shows that. There's a relation with life course. The events and processes starting before birth and during childhood may influence both physical health and their ability to maintain health. And of course, finally, the political economy, which my following speaker will talk more about, is the political process and distribution of power affect the provision of service and also access to health services. I will conclude by just again giving a quotation. This was also cited almost a century back by Hans Ginzer, as he's saying, however secure and well-regulated civilized life we become, bacteria, protozoa, viruses, infected fleas, leaves, ticks, mosquitoes, and bed bugs will always lurk in the shadows, ready to pounce when neglect, poverty, famine, or war lets down the defenses. And even in normal times, they prey on the weak, the very young and the very old, living alone with us in mysterious obscurity, waiting their opportunities. I think that's all I had to say. Thank you all for listening.